she has her skincare on.
Okay.
So this is good to know. Who's working the front desk? Like booking appointments and stuff. Everyone?
No, Mila and Cece usually do.
Okay, perfect. So I'll wait for Mila to come back because this is a good step to know. That when when they're coming in and you're booking a VIP, just ask them to come in with no skincare on. That way you can skip a step.
Save some.
Yeah, because if she's already it's okay if she showers and washes her face, but don't add moisturizer or sunscreen. Just come in bare. We're gonna do a little mock consent while we're waiting for our cellulose sponges. So, are you pregnant or breastfeeding?
No.
Okay. Have you been on Accutane in the last 6 months?
No.
Have you been in chemo or radiation in the last 6 months?
No.
Okay. Have you do you have an autoimmune such as lupus?
No.
Okay, good. Are you? That's pretty much it. Those are the important ones, and then the rest is consent of I will acknowledge I'm using the home care. I can't use any mechanical exfoliants at home, things like that. It's all very thorough about home care. So really the nitty gritty is chemo, radiation, Accutane, pregnant or breastfeeding, and autoimmune.
Does retinol matter? Or
Drink it wet.
Yes.
Okay, let me get you. You want it hot or cold?
No, cold is good. Can you ask me that one more time?
Retinol.
Thank you. Technically, just peace of mind, have them off the retinol, retinoic, whatever, for 48 hours prior to the peel.
Okay, just put that.
You don't need to pre-treat either with a VI peel. Like, you can literally have virgin skin, walk in the door and get it done. I've only ever used Cetaphil. Okay, great. What I was saying is that
when you get your cart to pull up.
here,
I'll use this. Okay, I can get it rolling.
when you guys are booking VI peels, what I was just saying is because we have to cleanse her, this will be like easier for your life. Just have them come in without any skincare on.
Okay, or makeup or whatever.
No
okay.
makeup, no skincare. My hands are clean. I don't even know if we need both. So what you can do with this is you can literally just,
And this is acetone?
no, this is the cleanser.
Okay.
So you can just squeeze a little on and actually just work that into her face with the sponge. And then we can use the dry one to clean it up.
She's just
Get right in
I'll
there.
get in there.
A very
Start the
gentle,
peel.
mild cleanse.
Yeah. Oh, I should have taken a before picture.
Oh, we will.
Okay.
We'll
And
cleanse
then-
her.
It's
you
better to
did?
do it once she has her face all clean.
Yeah, we'll
You can
cleanse
take
her.
your own, but I made sure to have one
Excellent.
just in case you forgot.
Yeah, we'll take one at this angle because it's right under the light. So if she's at home taking photos, use similar lighting to this. Even a flashlight on your phone will be good. Yep, we'll keep going. I think there's some more because it gets a little foamy. Perfect. I know, it's like perfect. And if do you want this one as a wet one?
Yeah, to remove
Let's
it.
do it. This part of the process, if you are cleansing, you technically, I guess, don't need gloves because now your hands are wet. So we'll have a towel
Change
and we'll
them.
dry them for you.
Oh, okay.
But if you wanted to just cleanse her first, then put gloves on. That way you don't have to.
Okay.
Yeah, we'll use one of these towels so you can wipe your hands. I realize that as she's doing it, I'm like, her hands are gonna be wet now. I feel like there's still little bubbles. Little bubbles, I know. Sometimes that can happen. It is a frothy, foamy cleanser, but keep in mind we're gonna acetone her, so it'll be okay.
So we do cleanse, double cleanse, acetone.
Yep.
Okay.
And then we're gonna dive right into the peel. Do you guys want to take a photo from this angle, or?
Okay.
Yeah. She's gonna get it right now. Perfect.
Oh, there's so many cameras. Now I'm uncomfortable. Oh God. Okay.
Do we have consent to film you? I'm too late.
I know, do we really
Yeah.
get a mask?
I got most of your hands.
Put like a little emoji.
So we're gonna start with our practitioner kit. This is going to be, we will remove her home care kit. Merry Christmas. We're gonna touch base on that after. So this right now is your practitioner kit. Each one's gonna be a little bit different because some of them have the Precision Plus and Purify with Precision Plus have boosters of hydroquinone and kojic acid. So this is good because you guys can learn how to put this in. If they don't have it, it's just one less step. So what we'll do,
Is that the one she's doing, Precision?
we're doing Purify with
Purify,
Precision
okay.
Plus. Yep. So it'll have the benefits of the Precision Plus, which are HQ and Kojic, but it also has benzoyl peroxide and hydrocortisone and all that. So woven gauze, your measuring cup, your acetone wipe, your boosters, and your vial. Now I'm gonna show you guys designed by Women for Women. Let's fold this up, make this a little trash bag, so that way you can throw all material in here and it's nice and concise. We're gonna start with the acetone. Now, it's pretty self-explanatory how to open a paquette, but you wanna be careful because this is very saturated. So, if you were to open this up like this, it would go all over her. You guys would be in big trouble. You're gonna always open this up away from the patient, you're not gonna ruin the floors. Acetone dries in 2 seconds. Shake it out a little bit, or if you do have a surgical tray, shake it out over the surgical tray. There's going to be leftover acetone in the bottom. So what you're gonna do when you get this towelette out and you unfold it, we're gonna position it upright because you're gonna go in after and dump the rest of the acetone. So we 100% wanna use the full packet. Now, if she were extremely oily, oil will prevent the peel from penetrating. It's okay to triple acetone if need be. I'd rather dry her out to the Sahara Desert than worry about the peel not being blocked basically by oil. So we're gonna make sure that I can see she does have some oils in her skin, but let's shake this out and you can open that packet up. Oh, perfect, love it.
I have a quick question.
Yes, love.
So, if for any reason somebody feels like they're actually having an allergic reaction,
Yes, we would stop the peel completely.
Okay.
And that's a great question because what we do between each pass is we assess how they're feeling. We want to ask them on a scale 1 to 10, where are you at? 1 being water, 10 being fire. We want them at a 2 before we restart. Yes, ma'am, go right in. There's no rhyme or reason to the acetone. Yep, treat it like a makeup wipe.
And then
You wanna work quick.
So, okay, so this is like in spa and
Oh, the smell.
Yeah,
Stink.
that's a whiff of
What is
acetone
it?
right up the nose.
What do you recommend if they feel like they're having an allergic reaction at home?
At
Is there
home?
something like a
A
natural
cortisone.
cortisone,
Just
like
an-
any aloe vera, anything?
Aloe, cortisone, antihistamine like Benadryl.
Okay.
That's just simple.
And then do you have them come back to get assessed by
You
the
can touch
esthetician?
base with them and
Or
have
do
them come
you-
back a week later maybe and just see. Perhaps
And then
you want to
pour
find,
the-
pour the rest on. That's very unlikely to happen. And actually, this is a great point. This is mentioned in the consent. Do you have any known allergies to phenol or salicylic? Most people don't know they have a phenol allergy until it's on the face. But the good thing is the skin is very responsive. If the skin is allergic to most people know if they have an aspirin allergy, it's salicylic. Most people don't know if they have a phenol. You will know.
Does she need to get this area?
Yes,
Yeah, I
we're
was
gonna
about
do
to
the
ask
next
if
one
we're
too.
doing
Thank you.
neck.
You will know if you're allergic to phenol. They'll tell you right away. You just remove the peel, cortisone, aloe, and send them on their way. Maybe have them come back a week later and assess what's going on. Maybe a medium depth peel wasn't right for them at the beginning. Okay,
Still a little
I know.
shiny there.
I'm a little. I kind of want more acetone. I know you have a little, but
Yep.
it's over
At the
there.
house, yep.
I'm sorry to
I'll be
do
right
that.
back.
Actually, wait. No,
You
sorry.
got it? Okay.
I have an extra one.
Okay.
Sorry about that. Let's go again. So this is showing you visually how important. So you
See that
split
she's
things.
shiny somewhere?
Her chin is shiny.
Okay.
You have to, and this is an esthetician's intuition. I can see that there's still some shininess on her face. We want her as dry and as matte as possible. When you see some oils in the skin, if someone's already dried to the bone, you're just gonna use that once and it'll be done. But we're gonna just dry her out right now. Yes, ma'am. Beautiful.
So how dry does your skin feel right now?
Guys. You okay?
Oh, my eyes are fine.
It's the
I'm
nose.
just, yeah, I'm
It's the
smelling
smell.
it.
I know, we try to work as
It's right
quickly
up
as
the
that.
nose.
I'm sorry, what did you just ask me?
Oh, I was just asking her. I'm like, how dry do you feel right now?
Yeah, do you feel dried out?
No,
See?
Oh,
you
okay.
feel soft.
It's still shining.
So this is also reminding me, if anyone has microbladed eyebrows that are fresh and they don't want pigment being compromised, or they have a face tattoo, you occlude a face tattoo and microbladed eyebrows. That's it.
With like Vaseline or
Yep,
something?
Vaseline, Aquaphor, doesn't matter.
Oh, mine were microbladed like a long time ago.
How long?
3 years,
Oh, yeah.
maybe.
3, 2,
Like,
1
does it
plus
make a
year, we're not
difference?
gonna pull the pigment. If
Okay,
they're fresh
okay.
like 2 weeks ago, 100% include them.
Never had a face tat.
I had a-
Before, so that would be brand new.
That would be interesting. But we have our body peels, and if someone has a full sleeve on their arm and they want to peel on their arm, we can't do it. The
Yeah.
TCA will remove the pigment.
Or that tattoo right here. You know, a lot of
You would
girls-
avoid.
Yeah.
Okay.
Shining on the chin, right?
Yeah,
Yeah,
body
but
chin.
we can't. This is enough.
Can't do it.
So we've done as much as we can, and I think we'll be all right. But I do see what you're talking about, but it'll be okay. So now let's open up our vial. Opening up the vial is interesting. White cap is standard removal, so pull the white cap off just like normal. Perfect. Now this is where this matters. So what we're gonna do, this is a pressurized peel, okay? So naturally it's gonna pop a little bit. The last thing I want is this to pop in your face or whatever it may be. So I'm gonna literally have you follow my instructions after I demo this. So you're gonna pull this little silver tab up to the sky vertically. There's a little gray ball on the top here, okay? What you do is you take your non-dominant thumb and you put it on that little gray ball. Now, if we were to try to break this sealant off right here at the top, it would break here and this would still be sealed. Then you need to get tweezers and it's a nightmare. So you're gonna pull it up one more to the sky to hear a little crack, then down and around. Keep this thumb on the whole time and just gently cover and remove. It'll pop right up. You're probably gonna have it pop the first time. Believe me, it took me like 3 times the first time. So pull that little tab up to the sky. Non-dominant thumb. Now pull it up one more.
Am I supposed to hear something?
Yeah, you'll hear it. There you go. See, hear that?
Oh, okay.
Now pull down and around, thumb on top the whole time. Yep, beautiful. It's a little awkward because it's your non-dominant, but this is where you can cover and just kind of gently
Cover
release. Yeah, your other hand.
Oh.
And just kind of let it.
Okay.
Perfect. Good. That was great.
Okay.
So now we're gonna dump the entire vial. Yeah, you smell the phenol. Phenol is strong. If you guys, if the scent is too much in-house, Lysol neutralizes phenol. So you guys can literally just get Lysol wipes or a spray, spritz down the countertop, and it will neutralize that scent because it is quite potent. Now we're opening our boosters. Doesn't matter the order in which they're applied in. These have 2 little grippies right here. You see those grips? What you do is you hold it over the cup and you take that grip and you just squeeze it till it all comes out in the cup. So I'm gonna have you come over here so I don't wanna drop any. Yep, perfect. Squeeze it all out. Excellent. Throw it away. Here's the other one. Once it's all done, you'll use that to stir the cup together. Weak. I know, it's actually harder than it looks. Excellent. Now use that, actually grab that again for me, the little, yep, and use it to stir. Yep, that's okay. Perfect.
For how long? Just.
That's good. So we'll open up our woven gauze. I want you to have this folded in half like a hot dog. So it's just gonna be 2 pieces that you fold together. It's very important to note that if you need extra gauze for whatever reason, it has to be woven gauze, and you only ever use acetone, not alcohol. Yep, just like that. Now what I'm gonna show you is when you dip this into the cup, it's woven gauze. It's going to shoot right up that. So you don't wanna dump this and soak it because then it's like gonna get ruined. You're gonna gently right to here, you're gonna dip it in the cup and then hold it on the side of the cup to drain and squeeze so it's not dripping everywhere. And then we're gonna bring it right over to her. So here.
No eye protection or anything?
Nope.
Okay.
So dip, a little more is fine. Yep, and then squeeze on the side of the cup. Squeeze.
Both sides?
Yep, you can actually literally physically squeeze it so it's not dripping. Perfect. Okay, that's good. 1 dip in the cup equals 1 pass. So we're not re-dipping. We're starting here. We're gonna start on the forehead. If you wanna work out vertically or horizontally, one other thing, firm pressure. So that's too light.
Okay.
You don't want to hurt her, yep, but you need to have firm pressure.
For the whole-
Perfect, yep. Firm, firm, firm. Excellent. Yep, now you can come from the cheek and work out toward the temples. Careful of the eye, yep. Good. Firm pressure. Nice and firm.
Through.
Yep, you can
Under
go
here?
all the way
Okay.
down, yep. Perfect. Also, we gotta be careful of the lips, because the lips will peel if you touch the solution on the lip.
Okay.
She's okay.
And then switch and go to
Yep,
the other
go
side?
to the other side.
It stings.
It does stink.
No, it stinks.
Stings or stinks?
Stinks.
Stink.
Smelly.
Smells.
Stinky.
Yeah, it's the phenol.
Stanky.
Stank.
Yeah.
Stink, stink.
Perfect.
Okay.
Excellent.
And then under.
So have
nose?
her roll her lip, tuck your lip for us. Yep, and just scoot right across. Yep, perfect. That's plenty. Yep, beautiful.
And you get
And
the
then
other
the
side of the nose.
So you can do the nose. There's so much cartilage in the nose that the nose very rarely peels. So you can always just go down the bridge. Now let's comb right under her jawline there. Perfect. Excellent.
Around and
Yes,
like a.
ma'am. That's
Okay.
perfect. Great.
Do you go onto the neck?
Yeah, you can do the neck. This part of the neck, the skin is so thin and the neck already gets pretty itchy, so we're only ever gonna go over her like trachea once.
Okay.
But then we can feather out around the remainder of the neck. Now the nice thing about this peel, there's no added dyes to it. It's the L-ascorbic acid that has that yellowish tone to it. So on some lighter Fitzpatricks, you can really see where the peel is, which is
where it's
really
going.
nice. So we want to make sure that this is absorbed, this is being sucked into her skin. We wait 30 to 60 seconds. Yeah, it's the
Smell
phenol.
it. I smell it.
How is your skin feeling right now? Scale 1 to 10, 1 being water, 10 being fire. Where you at?
I'm like pretty close to water.
Perfect.
I'm
she's,
fine.
She's almost at a 1.
I'm fine.
That's great. And you do want to give it 30 seconds to a minute just for the skin to have a natural response. God forbid something wonky happens. Yeah, I'm going to come on the other side actually really quick. And just check this side. This is looking good. And you can tell her skin is absorbing it quickly because what's going to happen with oily skin tones, it will pool a little bit and you'll finger press it right in with your gloves. Yep, you can try it. Yep, just like that. That's how you would do it if you saw it like
If I saw a little.
piling up or looking a little sweaty. So she's good. Let's dip again. We're gonna go dip, and second pass is on its
Now,
way.
when you dip for the second time, do you need a new gauze or can you
Nope,
use the
same
one?
gauze for
Okay.
every pass. That's why it's important to not soak
Soak
it
it.
so much and drain it so it
And
doesn't
the
get
second
ruined.
pass, we're starting the same way?
You know what? That's a good question. So we typically always start on the forehead because the forehead's very resilient. You don't peel that much here anyways. But
Okay.
her target for acne is here. Let's do the second pass from the chin backwards. We're gonna work backwards on this one. Firm pressure, nice and firm. It's a little foreign because you don't want to hurt somebody, but the more pressure you apply, the deeper the peel will penetrate.
Okay.
Great. Are you feeling any tingles at all as we're
Just a
touching?
little.
Okay, just a little. Good.
Yeah.
Perfect.
Oh, I forgot that.
That's okay.
Roll your lip in.
Up and then back to the forehead. Nice and firm. Excellent. Good.
I'm not sure if you can answer this.
Yes.
But, okay, say you have a woman
Mhm.
who
Do you have extra
regularly
gloves?
gets her eyelashes done.
Yep.
Are the
We do.
fumes from the peel gonna mess with the eyelash glue?
Not at all. Nope.
Okay.
Not at all.
That's a good question.
Do we have an
Yeah.
extra pair of gloves? I want to just do something really quick. That is a very good question, but no, that will not
Yeah,
happen.
you know, like the
know,
eyelash
like the
extensions.
glue can-
Because a lot of them do have
Yeah.
extensions or something
Yeah.
done with their lashes.
Oh, yeah.
And
It's good to know.
and the fumes, like it messes with it's a chemical.
Yeah.
Yeah.
You know what to tell them.
And those, yeah, the fumes from the lashes, oh my god.
Yeah.
Oh god, yeah, no. So what we're gonna do with the neck, I want to show you guys. So right now you can see there's kind of a like, especially on this side, you can see the marcation of like where the peel stops on her jawline versus her neck. So yeah, you can see it in the video. So you don't want her to have such a stark line.
Oh,
So
like,
yes, I'm gonna show you really quickly.
Okay,
So what you would do is you would literally start near the ear and just gently feather down like this. So we're breaking.
blending
Kind of like
makeup.
makeup.
Yep, exactly. We're blending that makeup.
You better
If
blend
older
that neck.
patients are here and their ears have a lot of sun damage, you can
Okay.
touch their ears too.
Okay.
Keeping in mind, we're only gonna go over this once. So when you touch the neck, it's pretty light. It's pretty light
So,
here.
okay.
And that's that. Now, if you can turn your head that way for a second, you guys can see how this is happening. Yep, so just like what I told you, you finger press that in. We just want to blend that out just so it's not looking like it's not absorbing. And then we'll check the other side of her face. Turn toward us this way. Perfect. See that? Just the marcation, you want to just blend it out. Excellent.
And then there was something on her chin. When she went
Let's
to
see.
turn, I saw a little,
Yep,
here.
perfect. You
Push
dab
that in.
that in. Yep, there you go. That's good. Excellent.
Okay.
Perfect.
Oh, here.
Good. Love this. Going well. And you
Are
can
you hot?
No.
Oh, okay.
Your skin is, she's absorbing it nicely.
Okay, yeah.
So we can, how you feeling? Scale 1 to 10, where we at?
I'm chilling.
She's chilling. She's ready for pass
wow.
number 3. We'll go back to the forehead. So dip and drain.
She said 30 seconds is sufficient? Okay.
Yep, 30 seconds. As long as she's feeling comfortable, you can get right back in there.
And the 30 seconds kind of gives you time to do the feathering and like looking around.
Yep, nice and firm. Here we go, pass number 3. Typically with the boosters, you do get a lot of passes. 7, 8 passes, which is a lot, okay?
Yeah.
As we carry on, step, 5, right? That's where that pressing of the peel motion really comes in, because naturally, when you start working on the forehead and you take that saturated gauze and you work outward, the peel is going to start to pool near the sideburns or the hairline. So you really need to press that in. It's a lot of solution. We want to apply solution on top of skin, not solution on top of solution.
And roll your lip in.
Roll a little bit. Beautiful.
Sorry about the sound.
Excellent. So we can start to see, we're on.
Do this side?
You did?
Hit it a little
I'm
extra
not
just in case. I don't know.
Give more.
No, I do. I don't know.
So we're gonna make sure that as we carry on, you will start to continue. So this is where it gets. We always want to let it try to be absorbed on its own. So that's
Okay.
why the 30-second mark, 60-second.
Would like fanning
then
help or no?
Yes and no. A fan's nice because it does help to dry, but that doesn't necessarily mean it's being absorbed. So we'll just wait a second. Yeah, you can feather her. Yeah.
And you ask every time
How
are
she's
they
feeling,
feeling?
yep.
Okay.
We only ever start the next pass when she's at a 2. Looking good. Excellent.
Kind of doing the same thing at her eyebrow too.
Yep, it happens in the brows, it happens on the chin, near the sideburns, and around the hairline. And let me tell you guys, if you don't push that in and you let them leave soaking wet, the solution's basically running off their face, they're not going to have a good peel. I literally walked into a doctor's office, and thank God, because I was walking in as the patient was walking out,
Still
and I
water?
literally turned her around,
Yeah.
brought her right
I'm-
back to the
I'm
doctor, and
a
I was like,
little
we need to
tingly
push
in the
this in.
forehead, but it's not tingly anymore.
Okay,
It's
good.
pretty much going away, like as I say it.
Okay, so we want to also assess a clinical endpoint. Frosting or crystallizing. Frosting or crystallizing. Frosting will look like basically you opened up salicylic, like a light powder, and it was like all over. Crystallizing is if she had like a little pimple here and it just looked like a little white circle was on top of it. We would carry on, we would go around.
Is this or is that just like
No.
no? Okay.
We would be able to still do the peel. We would just work around it. And if the frosting didn't dissipate and it was like from cheek to cheek, you would stop treating and it didn't go away, you would just carry on with the forehead. Yep.
Okay.
Frosting tends to dissipate after about 90 seconds. So you can, if you see it, wait a little bit more than a minute, see if it goes away. It normally does. Crystallizing, it's fine. It has to do with oil in the skin. It might crystallize like on a little pimple like that, and you just work around it. All right, we're good to dip for 4. Pass number 4 coming your way. Yeah, that's it.
Start again with the forehead or start down here now? Like alternate?
It's alternate. I like to alternate. I find that it gives nice distribution. Yep, there she goes. Now she's getting comfortable with it. Firm pressure, moving and grooving. Oh, jeez. Just trying to look and
We
see.
got it on video again.
You guys are gonna be laughing at me for the rest of life.
They'll edit those out.
No, yeah, please. But then send them to me in the group chat after laughing at you.
Funniest home video.
Yeah, exactly.
So the whole goal is to try to use all the
Yes,
solution,
yes, that's a
okay,
great
based off their
question.
tolerance.
So we're gonna kind of feather down the chin because it's looking, and we're gonna wait a little bit to see what that does on its own as far as absorbing, and then we're gonna press that in. That's a great question. Thank you for asking that. The objective is to use the full cup. But some patients, whether they have a smaller face or they're feeling a bit tingly, and you've done enough, you've done 5 passes, we can stop. But ideally, try to use the full thing.
Got it.
Okay, perfect. So guys, you can see now what's happening right here. It's starting to pool here, okay? It's starting to pool there, here. So this is a great visual because you guys always want to press that in. We're gonna wait another second or so. But if you let her leave like dripping,
No good.
it's not penetrating the TCA.
Okay.
The TCA is what makes the peel. If you had seen the patient, though, I stopped dead in her tracks and I said, nope, turn around. I literally was like horrified.
You're not done.
Oh my God, it was like dripping. It literally looked like she took her face and dumped in a bucket and walked out with it
Oh,
wet. And I was like,
no.
oh my God. And the doctor did it. And I had to tell the doctor so awkwardly in the back. I was like,
Listen.
so, okay, how are we feeling?
Good.
Tingles?
Some like around the chin
Okay.
where I have a pimple.
Okay, that's good.
That's pretty much the only one.
Okay, but you're feeling okay for the most part. So
Yeah.
let's press that in.
I think it went
around her
away.
chin. Let's press. Perfect. Good.
I feel it a little.
Here, I'll help. We'll double team. Okay. There you go. Perfect. Excellent. See what the difference that makes though? Is now you're really pushing it in as opposed to letting it just pool. Because if we did that, we'd say solution on top of solution. So she's good.
This doesn't even feel wet. Is it wet?
It was.
Is it? Oh, that's
We've
weird.
done, we're about to do pass number 5. So, because we did forehead, chin. Yeah, so this is 5. So, you're still feeling okay? Any tingles? Perfect. See, you can go right in now. The ones with boosters do take a little longer because there's more solution. But once you guys start doing these and you get the hang, it's like riding a bike. You'll get in here and you'll move quick. I'm obviously training you guys, so this is a little longer.
Oh, I didn't alternate.
That's okay. We'll do the next 2 at the forehead. Excellent. Firm pressure. Nice and firm. Beautiful. Good. Perfect. And roll your lip. The difference in coloring from her face to her eyelids is pretty amazing. So let's look at her chin. You're gonna feather down that.
Is this like super light or like a little bit of pressure?
Yeah,
Your face does not smell good.
thank you.
Okay, so we'll let this start to. That was 5.
And then just hairline and wait till this kind of.
Yep. Let's just let this dry for a second, especially on the chin here, because it's getting a little.
I just found that out like
Yeah.
yesterday.
Get in there.
Try to work a little quick.
But we could still do it if we have long sleeves. Not long, but
Okay. Looking good. How you feeling?
Good.
Sorry, I know it's the most annoying question.
No,
Hearing
it's
it
funny.
7 times in a row.
It's funny to hear you guys say that, like, there's a difference in how my face looks because I feel fine.
Oh, good. Okay. So let's press that into the chin because we'll be able to go back. Now, if you need a paper towel to clean those gloves after you press so many times, it's nice to have a paper towel or one of the thingy, what are they called? Like the sheets on top of the surgical trays.
Yeah.
You can just use that to clean your
dab,
hands.
okay.
Yep. And she's, Mila's getting a paper towel.
Because I'm like, don't touch anything. Nothing but the face.
Oh, I'm sorry for the camera.
Down here a little bit there. Perfect. You can use this really quick to clean your gloves. Doing okay?
I'm good.
Okay. We will clean those glovies of yours and then
Where do I put this guy?
this guy's not work. We keep using him. Okay. Oh yeah. Oh, you need to use this to clean this hand. I was like, what is happening?
Okay, I see why the like.
Yes. So give me this, and there we go. And now you're gonna dip again, and we're going back to the forehead. This is past 6. We're definitely gonna get 7.
And is 7 like even if you still
Yeah,
have
7.
a little liquid, you stop or
You don't. Yeah. I mean, 7
Is it
passes.
overkill? At
7 passes is plenty.
Okay.
Nice and firm.
Roll your lip.
Yeah, you can hit that. Almost done. Thank you guys for being so patient with me. This was a long training, so sorry if it was too long. There's so much info.
We appreciate the more information you
good.
give us, the
I
better.
know. Sometimes I don't want it to be overwhelming, but there's a lot that I can, that we can learn.
Very informative.
Yay. Okay, perfect. Do you need this? Oh, wait, you haven't pressed it
Oh,
yet. But
yeah.
your hands are still getting a little. You want your other hand? Are you good? Okay. We'll press in just a sec. If you guys did want to ever get like one of those like air fans, or
Oh,
a
yeah.
regular
Oh, like
a little
fan.
handheld.
Yeah,
Okay,
yeah.
Mm-hmm.
Okay, you can press and we'll
This
go.
time didn't need as
Not as much. It's starting to nicely absorb. That's good because we've been pushing in the whole time. If we didn't do any of that and then we went, oh my God, we would be sitting here pressing her face for like 25 minutes. No, I'm exaggerating, but like, you know what I mean. Okay.
on the lip a little. Can you roll your lip a little?
Roll that lip. Yep, nice. Good girl. Almost done. Okay. So we can finish strong here. We're about to do our last pass. You can hit it on the forehead here. Okay. And we will be D-O-N-E.
Feel bad being so rough.
As long as she's okay, you're okay. Is that
Yeah,
pressure too
no,
much?
that's
You can
good.
ask her.
It could be
Okay,
more,
good.
honestly.
Oh, see?
Okay.
Perfect. You can always communicate with the patient. Because what's happened is people have applied the peel too light and they don't peel at all.
The last one. We're
It's
getting
funny
the
because
crevices.
in skin school they're just like,
Yeah, it's
light,
just
light.
Nope, we gotta push that in.
Yeah.
Well, you're rolled.
And now you can use this to stream the neck. And I'm going to show you guys one final thing on the last pass of the peel, which is this one. We're going to run that gauze right through her eyebrow. Literally swoop the brow bone right through. Done. Swoop through. Done. Now, open your eyes and just look back at her. We're going to swoop in the pocket. Not
okay.
too close, but the last pass, swoop that
Lightly?
pocket. Very lightly. Yep. One and done swoop. Perfect. One and done swoop.
So just like the
Beautiful.
border.
Just
of
like
Okay,
that.
yeah.
That's it.
Okay.
And she's done. Woo! Let's give a round of applause. Great
Yay.
job. You did amazing. Amazing. We might want to press one more time, but you can pull off one glove if you need. You can throw that in. Remember how I was telling you guys earlier about that you would keep that saturated gauze if you were doing the tox booster treatment? That disgusting little brown gauze? You put that to the side for the doctor or the injector. You would say,
Okay.
hey doc, we're gonna use this to mark any injection site bleeding, things like that. It
Got
stops
it.
the bleeding and prevents the bruising.
Okay.
So even though it looks disgusting, you would literally just keep it on the side for him. After he injects, he'll use it to mark any.
Oh, they
pinpoint.
use it. Okay.
Yes.
No.
Not
okay.
you guys. Yep.
Okay. Yeah.
Okay, let's press her in. Mila, what I was just saying, we finished. So this disgusting gauze, if we were doing a tox booster treatment, we just applied the peel, he's coming in to inject.
Okay.
We keep that. We save it on the
And
side
that's
because then
where
he
the
would use it for pinpoint bleeding. Yep, to
Okay.
prevent bleeding and bruising.
And then so
And
now
then
we're
we
gonna throw it
throw it
away
away.
because we're
Yeah.
not doing it.
Correct. Yep, now we
Yeah.
throw it away because we're not doing it.
Okay.
But after he uses it to mark any pinpoint bleeding, he would
And
throw
then
it away.
like as a feather or as a deep press?
Just a light feather, just
Okay.
swoop away that blood.
And it's the anesthetic. You
Yep.
use that. Okay.
Yep.
Sorry, she said she was done. She's just
Yeah, no,
pressing.
girl.
I think
Yeah,
without
she
the
is
ball
done.
button.
Yeah, she's done.
Yeah.
Awesome. You're done.
No, you're fine. I'm glad I had it done before because I
Okay.
remember my experience with